two types of asthma, intrinsic and extrinsic. Extrinsic or atopic is
allergen accompanied by other allergic disorders such as hay fever, urticaria, and eczema.
The other type of asthma, known as intrinsic or non-atopic asthma, common triggers are
Respiratory tract infection, hyperventilation, gastroesophageal reflux, exercise, drugs, chemicals, cold air, airborne pollutants, hormonal changes, and emotional upset. What's happening to me? I'm getting so tired.
An asthma attack, bronchospasm occurs. The bronchial mucosa wall swells, and excess mucus production causes bronchoconstriction, causing prolonged expiration. Air is trapped in the lungs, causing hyperinflation of the lungs, and as a result causes excess tension. The accessory muscles are used to compensate, causing dyspnea and fatigue. Because of the air being trapped in the alveoli, perfusion is reduced, causing a decrease in oxygen or hypoxemia. Pulmonary vascular resistance occurs. There is an increase in hyperventilation, and hypoxemia puts a strain on the heart.
In those with asthma, the bronchioles are hypersensitive, and when exposed to an allergen, the inflammation process begins. In the epithelium are dendritic cells, also known as macrophages, and when the allergenic antigen enters the body, they are taken into the dendritic cell by endocytosis. The dendritic cell then travels to the lymph nodes where helper T cells are waiting. The helper T cells then release cytokines. These cytokines signal the eosinophils to cause inflammation and increased mucus production of the bronchioles. The cytokines also cause plasma cells to release IgE. The IgE then bonds with the mast cell, creating an antigen-antibody complex. This signals the release of histamine, which also causes inflammation of the smooth muscles of the bronchioles and increased mucus production, narrowing them. On the left is a normal bronchiole. In the middle is what a bronchiole would look like in those with asthma, as they are always in an inflammatory hypersensitivity state. When exposed to a trigger, the inflammation of the smooth muscle increases and the mucus production increases as well, causing bronchoconstriction that results in epithelial damage and overproduction of mucus, oedema, known as capillary leakage, bronchospasm, and airway remodeling, with symptoms such as wheezing, shortness of breath, chest tightness, and cough. Tachypnea, tachycardia, use of accessory muscles, moist skin, anxiety, and apprehension. The respiratory system also regulates acid-base balance. When alveolar exchange of CO2 is impaired, this causes respiratory acidosis. To restore homeostasis of acid base, the body begins to hyperventilate.
What can I do to help it?
Let's go over your treatment options. Beta-adrenergic agonists give acute relief of bronchospasm. An example of the type of medication is Advair. This drug can bind to the beta-2 receptors, mimicking the norepinephrine to enhance a sympathetic response. It causes bronchodilation by relaxing the bronchial smooth muscle. A treatment for long-term prophylaxis would be a glucocorticoid. An example of this is Symbicort. These drugs are taken to suppress pre-existing inflammation of the bronchioles to prevent acute asthmatic attacks from occurring. It can be used in conjunction with beta-adrenergic agonists. We'll get you a prescription to reduce inflammation and help open up the airways to help you breathe better.
Okay, thank you.
In summary, our first main key concept is homeostasis. When the bronchioles constrict, the airway is obstructed, causing an increase in breathing and fatigue of the heart, which puts the body out of balance temporarily. The second key concept is proteins. Cytokines are a protein, as well as histamine is used in the inflammatory process and is a hormonal protein. The third key concept is cell membrane. This occurs in the dendritic cell when it takes in the antigen allergen in the form of endocytosis. This also occurs as exocytosis as the cytokines pass through the cell membrane out of the T cell, and as the IgE passes out of the cell membrane of the plasma cell by exocytosis as well.